All right, welcome. Today we're going to break down the psychiatric interview. And let's be real, this is probably the single most important tool in your entire psychiatric toolkit. It's way more than just a chat. It's a precision clinical instrument. Mastering this is absolutely fundamental, and this explainer is designed to give you that solid framework to build on. Okay, so here's our game plan. We'll start with why this interview is so different from any other. Then we'll cover how to set the stage for success, dive into the art of asking questions, tackle those really tough scenarios, and finally, how to wrap it all up. Let's jump in. So what really sets the psychiatric interview apart? Well, think about it. In most fields of medicine, you've got labs, you've got imaging, you have all this objective data. In psychiatry, the interview is your CT scan. It's your primary diagnostic tool. It's where you get the history, observe the behavior, and, this is critical, it's where you start to build that therapeutic relationship, which is the very foundation of treatment. And this slide really nails that fundamental difference. See, in general medicine, you often verify a patient's symptoms with hard data. But in psychiatry, the patient's subjective experience is the data. Their story, their perception, their feelings, that's your primary source material. And that means your ability to connect with them and build trust isn't just a nice to have, it is everything. So let's get really clear on this word, rapport. It's not just about being friendly or making small talk. You should think of rapport as a clinical tool, just like a stethoscope. It's the foundation of trust that gives a patient permission to share their most vulnerable thoughts and experiences. Without it, you're flying blind. You won't get the accurate information you need, and you could end up heading down the completely wrong path. It is the key that unlocks the entire process. Okay, so we know rapport is everything, but how do you actually build it? Well, it starts before you even ask your first question. The environment you create, both physically and psychologically, can literally make or break the interview. Your goal is to engineer a space where the patient feels safe enough to be truly open. And these points here, they're the practical nuts and bolts steps. Privacy, of course, is completely non-negotiable. And check out that safety tip. Sitting near the door is a simple move that keeps both you and the patient safe. Even little things, like getting rid of a giant desk between you two or silencing your phone, they send a really powerful message. And that message is, for this time, you are my only priority. Now, physical safety is one thing, but psychological and cultural safety is just as important. And this isn't about memorizing a textbook of cultural facts. It's about being curious and respectful. You have to ask, not assume. And here is a hard and fast rule. Never use family members as interpreters, especially for sensitive stuff. It just creates a minefield of conflicts and kills any chance of honest disclosure. Always, always use a professional interpreter. All right, we've set the stage. Now for the main event, the very heart of the interview. This part is about way more than just running through a checklist of questions. It's a true art form. It's about how you ask, when you ask, and maybe most importantly, how you truly listen to what's being said, and just as often, what's being left unsaid. Those first 5 minutes are unbelievably important. These steps aren't just pleasantries, they're strategic. For the patient, this is the process that turns you from a complete stranger into a trustworthy professional. When you're clear about your role and the rules of confidentiality, you're empowering them. You're setting a collaborative tone right from the get-go. This question right here, or some version of it, like, tell me what's been going on, is your single most powerful opening tool. It's so simple, it's broad, it's open-ended. What it does is it hands the steering wheel to the patient. It lets them start their story where they feel it's most important. And their answer immediately gives you this treasure trove of information about what's on their mind, how they see the world, and even how they organize their thoughts. So you've really got 2 main types of questions in your toolbox. You always want to start with open-ended questions. They encourage the patient to talk, to build their narrative. Closed questions are for precision. Think of it like this. Open questions are your wide-angle lens to see the whole scene. Closed questions are your zoom lens, your scalpel. You use them strategically to zero in on specific details you need for your diagnostic criteria. The flow is always from broad to specific. Now, if there is one skill to rule them all in this entire process, it is active listening. This is the difference between just hearing words and truly understanding the human being sitting across from you. It's about tuning into the emotion, the body language, the pauses, the hesitations. You're listening to the entire communication package. So how do you actually do this? Well, you start by noticing the little things, a shift in their tone of voice, a sudden change in posture. And this is a big one. You have to get comfortable with silence. Seriously, it is not an awkward void that you need to fill. It's a space for the patient to think, to reflect, and often to gather the courage to say something really important. Sometimes a simple, patient nod is way more powerful than your next question. Okay, let's shift gears and talk about the tough stuff. The moments that test even seasoned clinicians. The interviews that involve really intense emotions or high-stakes risks. These are the situations where your training and your ability to stay calm and grounded are really put to the test. So really think about this for a second. Picture yourself in the room. A patient starts to cry, or maybe their voice raises in anger. What's your first instinct? What do? Because the goal isn't to shut down the emotion. The goal is to validate it and manage the moment therapeutically so that you can keep that crucial alliance intact. Here's your game plan. First and foremost, you stay calm. Your calm is an anchor for them. Then you name the feeling out loud. I can see this is really frustrating for you. That simple act validates their emotion. See, you don't have to agree with the reason they're angry, but you're validating that the feeling itself is real. That's what de-escalates the situation and shows them that you're on their team. Now, this is probably one of the most important slides in this entire explainer, so listen closely. Let's be absolutely 100% clear about this. Asking a patient about suicide will not plant the idea in their head. That is a dangerous, persistent myth. The truth is, asking directly can be life-saving. It opens a door they might have been desperate for someone to open. You are not increasing risk. You are increasing safety. You must ask. And when you do ask, it has to be systematic. It has to be direct. Think of this framework as a logical funnel. You start broad, with passive thoughts. Have you felt like life isn't worth living? Then you get more specific, moving to active thoughts. And then you have to ask about a plan, about their access to means, and about past attempts. This isn't just a random checklist. It's a structured inquiry to accurately gauge their level of risk. All right, just like a strong opening is critical, a thoughtful, deliberate closing solidifies the entire encounter. This is your chance to make sure the patient feels heard, that they understand what's going to happen next, and, ideally, that they leave with a sense of hope and a clear path forward. And this is your framework for a great closing. Summarizing the key points shows you were listening, and it gives the patient a chance to correct anything you misunderstood. Clearly explaining the next steps is huge. It reduces their anxiety about the unknown. And always, always thank them. They've just shared some incredibly personal and difficult things with you. You need to acknowledge that courage. And remember, the work isn't quite done when the patient leaves the room. Documentation is obviously vital, but look at that third point. Reflect. What went well in that interview? What was challenging for you personally? What feelings did this patient bring up in you? This reflective practice, this is what will transform you from someone who just follows steps into a truly expert clinician. And that brings us right to our final thought. The psychiatric interview is this incredible fusion, isn't it? It's the art of human connection and the science of clinical inquiry. It's about systematically gathering data to meet diagnostic criteria, while at the same time forming a genuine, empathetic human bond. The challenge, and frankly, the incredible reward, of your career will be learning to master that balance. So the question to leave with is, how will you do it?